So anyway, on to the programme. I'm not going to say any more other than to introduce Felicity Waters, who's been working really closely on all of the research communications, and she's going to tell us a bit about that, what's been happening in the last year, and what the opportunities are for the future of communications. So over to you, Fliss.
Hello everyone, good morning, it's lovely to see you, wonderful to be here. As Nikki said, lovely sunny day. My name is Felicity Waters, I'm Head of Communications, Engagement and Involvement for Health and Care Research Wales. I am fairly certain that I will have called, emailed or nagged you at some point over the last 12 months, making ridiculous requests with ridiculous deadlines. And I want to thank you for all your support over the last 12 months with our comms work, and for valuing everything that we do. It's been a real privilege to work with you all. I think despite its awfulness, obviously, the pandemic has given us the opportunity to really showcase Wales, showcase Welsh research and Welsh expertise. And an opportunity also to position us as an equal partner among the devolved nations as part of the UK effort. And that was one of my priorities last March, was how we use this opportunity to position Wales as a key player in the COVID-19 research effort. So that's what I'm going to talk you through today, and grateful for any queries or questions in the chat. Please do put your comments in, and our hashtag as well is Team Research 21. So 114 COVID-19 studies in Wales in the last year, 32 of these are urgent public health studies. And I know I'm not supposed to use these adjectives, and I'm not sure if it was used yesterday, but I make no apology for using this word, but that is a phenomenal achievement. And such a complex collaborative research effort I felt needed a collaborative comms approach to support it, and that's what we aim to do. I think if all of those sites, all of those studies, those hospital locations had done their own individual comms, I think that would have diluted the impact of the Wales-wide contribution, clearly. It would have risked messaging errors as well, especially given the very strict protocols that were coming down from the trial sponsors and the study teams, and potentially also undermined the recruitment efforts as well of our participants. So the mission was last year building brand research in Wales. Not an easy feat, but something that we were able to do with the support of multiple partners. So with Health and Care Research Wales coordinating the effort, working especially closely with Public Health Wales and Welsh Government, we were able to pull together a really collaborative effort. And we could not have done it without your help. And the support of all of the partners, including university comms leads, health boards comms leads, and others as well. And logistical support as well was so vital over the last year in terms of media interviews, setting up interviews on your sites, finding locations for filming, and also requests for data and quotes for press releases. And really this coordinated approach allowed us to have basically a one-stop shop for research in Wales, for the media, not just the media, but for study teams and for the trial sponsors as well, so that we were able to turn around their requests with consistent messaging and a coordinated approach. So on behalf of Public Health Wales, Health and Care Research Wales has so far led the communications for 3 vaccine trials in Wales. As you know, that's Oxford AstraZeneca in Newport, Novavax in Wrexham, Janssen in Cardiff. And events have overtaken us slightly because Medicago in Swansea Bay has got underway this week. And as you can imagine, it's been a trickier task this time, recruiting, because we're in a different environment now than we were last year. But that study is underway, and Valneva, there's still a question mark over that, whether that will go ahead. So how did we work together, and how did we bring all of this together as one communications effort to ensure coordination and consistent messaging? So we developed a communications plan for each vaccine trial and study, And the aim of that was not just awareness raising of the fact that the research was taking place with the public, but also crucially for recruitment and to bring participants into each trial. And we were able, through this comms plan, to really target our audiences, use specific radius, geography, and also have consistent messaging as well that's coming down from the trial sponsor. And we had a communications working group for each trial, chaired by myself at Health and Care Research Wales with the support of my team. Crucial to this whole process was almost daily liaison with the trial team, the booking service, and a big shout out there to Alex Hills and the booking team, who did a fantastic job and continue to do a fantastic job in coordinating that. Welsh Government comms as well, really key to all of this, because as you know, they have been working on the vaccine rollout. So we needed to make sure that our messaging was consistent with the vaccine rollout and we weren't going to be saying anything at the wrong time. And also key collaboration then with the devolved nations comms leads to agree key messaging with NIHR, DHSC, etc. One thing we've done for the first time actually in the last year is develop a formal media handling protocol for COVID-19, and this is something I think we can adapt for future use. And this is basically a guidance document that we provided to the partners involved in a trial or in a study, mainly for the vaccine trials actually for this, giving them guidance what to do if they were approached by a journalist or they were approached on social media for comment. And of course, because all of this is such high profile, it's not tricky these days for journalists to track somebody down on social media and try and get you to comment. So that protocol really tried to bring everything together and give consistent guidelines to everybody. So that protocol then set out Health and Care Research Wales's lead on media relations and press interviews, obviously to provide that one-stop shop, so that when the BBC came to us, for instance, and said, right, we want to do something on 6:30, we were able to work with them to pull a package together, turn it around within a couple of hours. You get the key expert, you get the data, and you get the location, and all of that is done in super quick time. And then another part was liaison with Welsh Government on ministerial briefings to make sure they were kept up to date. And I will talk a bit about that a bit later on. So the challenges then, and I know people talked about the challenges yesterday, and we weren't immune to it, as with all things new, reflecting probably some of the challenges you felt on the ground as well. So the first one, ensuring Wales and the devolved nations as well, Scotland and Northern Ireland in particular, are reflected equally in UK-wide comms. And this is not a new issue, as Caris and Kieran referred to yesterday. We have worked together on an equal platform, I would say, like never before in the last 12 months. This has been a very significant progression, but there is still a lot of work to do. And it's not just about having our Wales branding and our Wales logo on any press releases. It's about thinking of Wales, Scotland, Northern Ireland research communities as equal partners to NIHR and DHSC, and that is work in progress. So timings then were, as you probably know yourselves, quite stressful at times, and I think I had my head in my hands on a number of occasions, awaiting the pre-screener link and the green light. And translation turnarounds, obviously a unique challenge for us in Wales. But I think the devolved nations are now fully aware that we do need more than 20 minutes to translate a press release and get it out to the BBC. So that was a key challenge. So our collaborative comms approach was also used to promote other COVID-19 research. So as you can see there, as well as the vaccine trials, we promoted the quite high-profile sewage study by Bangor University there. SAIL had a lot of coverage, which we call SAIL the Welsh Super Database and Technology Platform, to make it accessible to the public, and the media seem to like that. And if you go onto our website, Health and Care Research Wales, you will see promotion of Genomic, Principle, Siren, RemapCap, Recovery, and many others. So the impact of the coordinated communications approach. So hopefully some of you will have seen some of the press coverage that we were able to generate. Again, thanks to all of your support for helping us to pull this together. And one of the key pillars to ensure impact was the deployment of Wales experts. And they were able to convey the key message that Wales is at the heart of the UK effort. They were able to position Health and Care Research Wales as the lead voice of research. And as often happens when you have a UK story, the default for the media, particularly the UK media, is that they will go to the DHSC and NIHR for comment. But increasingly so over the last 12 months, we have positioned Wales so that we now get calls from 5 Live, from other networks for the Wales position and asking specifically for Dr. Nikki Williams, which is, you know, that's a great progression. So we did generate significant media coverage, BBC, ITV, S4C, regional press, such as the Wrexham Leader, Swansea Evening Post, and also live interviews on Good Morning Wales and Global and Heart Radio. And I think what's important to share as well is that we're not just interested in media coverage for media coverage sake. You know, this had, the aim was to increase awareness of research and the importance of the value of research among the public at this crucial time. But our clinician-led news and appeals ensured we were able to get the participants in that we needed, and that was the critical thing. So just to give you an example of some of the evaluation, after the Oxford AstraZeneca vaccine approval, we generated 13 pieces of media coverage. Our social posts reached 68,400 accounts, and our Facebook following grew by 194% following the December the 30th announcement. That's the day before New Year's Eve, which, you know, is incredible really, and all because this was all generated because of Wales's involvement in the AstraZeneca Oxford University trial in Iron Bevan University Health Board, and the fact that we'd raised awareness of that trial and the experts there in advance. So another key pillar for us was harnessing the power of our key influencers, which is an important part of any comms and engagement strategy, and also the senior people in our partner organisations. And as you can see there, a lovely tweet from Len Richards, Chief Executive of Cardiff and Vale. I think Wales has really faced into the requirements for research with regards to coronavirus. Let's lock that in and develop Wales as a real powerhouse in terms of research. And he's tweeting a tweet from Betsy research team, thanking them for their contribution to the Novavax trial. And all of this activity helps to build the profile of research in Wales, keeps the momentum going at a critical time, and builds trust, not just with the research itself, but with you, the researchers and the research teams. And critically, and this is something that Mandy Edwards, I think, mentioned yesterday, really critical, it helps to make research a core value within the NHS, that we need to get research up there at board level and influencing locally. And that's something I'm looking to work with the R&D directors on this year, to make sure that we build on what we've achieved the last 12 months and to keep the value of all research on the radar. And our ultimate pillar was, of course, putting our participants in the spotlight. And there you can see Alice Hughes, Novavax trial participant in Wrexham, and Brian Begg, who did a lovely Q&A blog for ITV Wales on his personal experience of taking part in a study. And the jury is out at the moment, actually, whether it's Orod Ozanlu or Brian Begg who are going to be the first to get a media agent, because the both of them practically became media stars, and the media really took to them, their personalities, and they were able to humanise the research. And that's what the media wants. They want case studies to bring stories to life, and that's what these participants do. And the stories of participants are so powerful, so impactful, that's how we then generate further public involvement and we get more people into our studies. And we also achieved impact, as I mentioned before, from the ministerial briefings. And I'm sure over the last 12 months that most of you will have seen at least one briefing by either the CMO, Vaughan Gethin, the Health Minister, or Andrew Goodall, NHS Chief Executive. And Health and Care Research Wales was cited in several of these briefings. And as you can imagine, for them, it's really critical that they have good news to promote and be able to convey, because the sessions, the briefings are really quite negative, because they're updating on hospital admissions, on deaths, the daily death toll. And I have to say that, the Minister's special advisors were so glad to hear from us when we were able to give them a page briefing on how the vaccine trials were progressing, how the studies, principle, recovery, any news lines we could get to them. The key data, bullet points, they could quite easily put into the Minister's briefing. So that was a really good tool for us. And what it also did was raise further awareness of Wales Research and Health and Care Research Wales and what we are as a community. And off the back of one of those briefings, we had a call from 5 Live wanting to do another interview on the Wales position. So the future then. Caris talked yesterday about the new vision for clinical research, which was published last month, and we now will start working on the implementation plan alongside the 4 nations. And it's a real opportunity for us to work collaboratively and to build on the lessons of COVID. And I think what we've been able to demonstrate is that collaborative comms, coordinated comms effort also works. And really, I'm very keen over the next year to build brand research in Wales further to ensure that we remain a key player in Wales. So what now? The pandemic obviously has put health and care research at the forefront of all our minds, and we now want to keep all research in the public eye. And let's build on that new awareness, that new understanding of research that COVID has brought. Let's build on that good feeling that people have about research to be able to have the same value for all research and raise awareness of the value of everything that we do. We need to be doing more to reach and engage more people from underrepresented communities, sharing more of our human interest stories, such as participants and those who have been involved in the research process, and celebrate existing research as well and its impact. I'm very keen as well to champion the key players, yourselves. And if you've given me your contact details, I'm afraid we won't forget them, we won't lose them, we will be in touch. And we are looking to set up a comms and media training programme later this year to really start to build on that championing of our key people in the Welsh research community. So the key messages for the future. These surely must be our key messages after the last 12 months. Research and science have been our salvation in the pandemic and is going to be again. And all of these key messages, and the ultimate one, of course, is research improves lives. All of these are going to provide the foundation of a public engagement strategy for Health and Care Research Wales that we're currently developing as part of the Discover Your Role Welsh Government policy, and we want to develop with you as well to build on the last 12 months and move us forward. It just remains for me to say diolch yn fawr, thank you so much. First, I want to say thank you to my team, the Communications Engagement and Involvement team. I am so proud of each and every one of them. They're a fantastic group of professionals, and they have risen to every challenge over the last year. They've been fantastic. I also want to say thank you to the Health Board, particularly my colleagues, the heads of comms across Wales, and the university comms leads, and a particular thanks to you, the research community, and the R&D directors for your support of comms and really appreciating the value that we can bring to your work. So all I would say is watch this space for what comes next, and I'm really looking forward to working with you in the future. Glad to take any questions. Diolch.
Thank you very much, Felicity. Really interesting work through the year. And I think, Radio 5 Live keep phoning on random issues, which I keep redirecting to you to find somebody else to talk about. But a few questions that have come through. So Mandy Edwards has asked, what can we do to help Welsh research stay on the agenda, stay in the spotlight to continue the momentum now that we've had it through the last year? And I guess you've covered a bit of that in you know, in your last few slides. But what are the other practical things that you and the people in the audience really can do to support that?
Well, I think they've already done an enormous amount during the last 12 months. And really, I would say I want to build on that with them. I want to make more connections with more people, myself and my team. And obviously, it's been difficult, I think, over the last year because things have been virtual. And I think once we can get back face to face, you know, it would be lovely to come and see your work, come and visit your sites and where you work, and really build those relationships further, because that's what this is all about. You know, it's building those relationships. I would say as well that we've got a unique opportunity right now. Now is the time. This is why we're putting together our public engagement strategy now. And we're hoping to have a draft by the summer so that we can be ready to launch a public awareness campaign about all research building on COVID. Obviously, we don't want to look back at COVID too much, but we need to use that as the platform. And we're also going to be looking at a podcast series as well. So that's something that you in the research community, and Mandy, you know, you might be interested in helping with that. We want to bring out your efforts, your stories, your participants, and we can only do that if you tell us about your work on the ground. So if you keep doing that, we'll also be out to see you. And yeah, I think it's a really exciting time. But thank you for that question.
Yeah, and I guess if people do have a good story and do have something that they think, we're all very too humble, I think, in not shouting from the rooftops all the good things that we are doing, or recognising that actually we're making a real impact and a positive difference for patients and the wider community in those studies. And so what do you suggest people do in terms of highlighting those things to you? What are the questions that they need to think about, and then how do they get in contact?
So we have an inbox which somebody in the team can put that on the chat now. And I would say don't overthink things. You know, often the things that we do day to day, which you don't think are anything special, are actually really brilliant for publicising. So don't overthink it. Don't think, oh, that's not going to be good enough to get into the press or you know, whatever. You know, just get in touch with us. Let us know what you're doing day to day. We can find an angle in that, and we also have a multitude of channels that we can use. So it's not just about media. You know, media, I would say, is about 20% of our work. We are trying to expand our communications channels right across Wales now. So like, we're looking to do a podcast series. We are trying to put more activity out on Instagram to target our younger audiences. We've obviously got the website, we've got social media, but part of the public engagement strategy is going to be asking our partners and our networks to reach out to their networks, because with all the will in the world, we don't know everybody and we can't do comms by ourselves. So we need to build those relationships with our partners, which we will be doing through the public engagement strategy. And, you know, we'd welcome any suggestions at all on that public engagement strategy from you who are, you know, working frontline in the research community, because you know this better than us. So I would say get in touch with us. You can pick up the phone to me or anyone in my team, or put something in the inbox and just say, might this be worth something? Can we do something with this? We're more than happy to have those ideas.
Lovely. So there's an invitation there, and Reshma picks up on a point you were making about the connections through the last year, and wanted to know a bit more about. Do you think that you've made connections in the last year that you wouldn't have otherwise made? That you've opened up relationships that had been previously hard to establish, and just tell us a little bit more about that.
Yeah, absolutely. You know, before March, the Devolved Nations Heads of Comms group didn't exist. So, you know, we now have that network, and we now meet, well, we're meeting weekly at the moment because of the activities ongoing. And those are key relationships. You know, the heads of comms for Scotland, Northern Ireland, England, you know, they're just working together. So, for instance, International Clinical Trials Day, we're going to bring together a coordinated approach for that, and somebody in my team will be in touch with you all about that. But I think as well, it's also developed new connections within our Communications Alliance. So the Communications Alliance we have, again, that was set up about 18 months ago now. And that is an alliance of our funded infrastructure, as well as the Health Board's comms lead. So all of the heads of comms, all their deputies in your organisations will be part of this alliance. And it has enabled us to open up all kinds of networks. So we now have far more influence within Welsh Government and within the Health Board comms network. And to, you know, if we got a message to get out to the medical directors, or there's, you know, there are board papers that we know that, you know, need to include, you know, something on research, we can help with that. So that's my shout out to the R&D directors as well, to please, you know, use me. I used to be head of comms at Cwmtaf, Morgannwg Health Board. I was there for 5 years. It's a bit about knowing how the internal networks work. And I think the whole of the last year has opened up so many new opportunities for us.
Lovely, thanks, Fliss. And any sort of stories, I suppose, from behind the scenes that have either been those head in the hand moments or made you fall off your chair laughing?
Oh gosh, yes, there've been many of those. I don't think I can share any though, because they involve lots of swear words, which wouldn't be appropriate for this forum. I think my main bugbear is having Wales seen as an equal partner, yeah, there have been many robust discussions on the comms calls about that particular issue, and but I think they do get it. It's just a question of you know, actually implementing it, but it's not something I'll be keeping quiet about anytime soon.
Yeah. And on the receiving end of some of the interviews that we've done in the past year, you try and do a bit of prep for what questions you might be asked. But I know that that one of our colleagues was asked this week. I don't think the answer went out in the interview, but was asked whether the plant-based vaccine that's about to trials about to happen in Swansea was better for vegans, and I don't think had anticipated that they might be having to answer that. But so we do get asked random things, but you know, it's been a good experience to get a bit more media training in on the job, if you like. But as you say, we're going to do some media training which will give people a bit more confidence in how to deal with radio, TV, etc. And most of it's pre-recorded that I've done anyway, and as you've said. So we'll get some other people on the screen this year. So, as you say, got a bit of a competition going on who can get the most coverage. We did a little tracker, didn't we, of what impact the media coverage had, the individual recordings had on recruitment, because you could see the numbers tick up in direct relationship to when we were on the telly and stuff. So, any other final comments, Fliss?
I just wanted to say, with the media training, please don't be frightened about that, because people often see, you know, the traditional ways of offering media training in organisations, from what I've seen, is they're quite frightening experiences where you have to do a live interview and then it gets recorded back. You know, what I want to do is a far more holistic is another word that's overused, but a more holistic session with you all, where we can talk about how you use your influence locally as well. You get your local stories out within your health boards, within your research organisations. It's not just about doing a media interview. You know, that would probably be, if you wanted to do that as part of the session, we can offer that. But you know, I'm thinking of pulling a programme together that's far more interactive and that is tailored to you and what you need in your organisation. How do we get research and research issues on board agendas? You know, I've seen how NHS health boards work, and, you know, research isn't up there. You know, that's the reality. It's not up there unless there's something, you know, some really, really good data. But there are ways that we can work to influence locally by targeting the right people and working with you all on the ground with that. So I guess it's just the message, don't be frightened of media training. You know, we'll be pulling a programme together. I'll also be interested in your views, what you'd like to see from that training. And it'll include sort of comms awareness as well, you know, and how to engage better with participants, you know, how to bring people in, that sort of stuff. So yeah.
Yeah. And when you look back over not just the last year, but your career and the media work you've done, what's the sort of example of a story that starts very locally as a small little story and then has kind of gone mad?
Yeah, well, that's yes, there have been many of those occasions, but I think the most high profile one was at Cwmtaf Morgannwg when the scandal broke on the maternity services, and I was at the heart of that, advising on media, and yeah, we had the Sky News helicopter and all sorts involved in that. So that was very high pressure. It started off local, but obviously became a national story within a few days. So that was an experience. But thankfully, although the pandemic has been awful and affected so many people, you know, I think for once a high profile issue, you know, has actually given us an opportunity. We've been able to get something positive out of it, which is that, you know, to bring out the expertise and to showcase what you all do with research. You know, and I have to be honest and say that, you know, when I was head of comms in Cwmtaf, I had no idea the breadth, the scale of the work that you were involved with. And, you know, that is something I constantly push now with my heads of comms colleagues on their weekly call. So they certainly know about research now.
Yeah. And you mentioned earlier about the public involvement work and public engagement that we've been doing. Do you want to just say a little bit more about that? Because we haven't got public engagement specifically on the agenda today, and it's an opportunity just to share some of that work.
Yes, so we are in the process of pulling together a public engagement strategy, and we have a small working group set up to advise and assist us with that. And that is all part of the Discover Your Role Welsh Government policy to increase public involvement in all research in Wales. And the next forum, actually, which will discuss Discover Your Role and the actions in there, is in May. And one of the team can hopefully put on the chat which date it is. I can't remember. I think it might be the 20th. And that is an opportunity. We had 90 people there from the research community talking about public involvement at the first meeting. So we hope we'll get those numbers again. But public involvement and engagement is critical to what we do, as we've seen the last year. And, you know, we need comms to be able to push that forward. But what is our ultimate goal? Our ultimate goal is to ensure research improves lives, and that means we need to engage, and we need to engage in order to involve. So it's a priority piece of work which Reshma is currently leading on, and she and I and others are working very closely on that. So if you have any comments about Discover Your Role or would like to attend the forum, you'd be very welcome.
Lovely. And I think Reshma's put in the chat is the 11th and 13th of May.
Sorry.
So if people are in I want to know more about that, then information will be on the website as well, and in the bulletin, etc. Well, thank you so much, Felicity, and it's been great working with you, and I'd echo what you said about the amazing work that your team have done to support us nationally and also locally in terms of recruitment to studies, be it COVID studies or also other studies as they've happened through last year and before, and will continue to do going forward. So thank you very much indeed.